What happens when a hospital janitor performs emergency surgery and saves a dying soldier's life? Subscribe for stories where forgotten heroes prove their worth. This is Dr. Victor Kane, age 68, once a legendary combat surgeon, now mopping hospital floors. Until the day everything changed. Fort Bragg Military Hospital operates 24 hours a day, serving over 50,000 active duty personnel and their families. The building is a maze of sterile white corridors, the constant hum of equipment, the smell of antiseptic mixed with floor cleaner. In this world of life and death decisions, there exists an invisible workforce. The janitors arrive at 4 a.m. They scrub operating rooms after surgeries, empty biohazard bins, polish the endless hallways. No one sees them. No one remembers their names. They are ghosts in blue uniforms. Victor Kane has been part of this invisibility for the past 3 years. At 68, he pushes a cleaning cart through the same hallways where military surgeons save lives daily. His hands, once steady enough to perform battlefield amputations, now grip a mop handle. His colleagues respect him. He's punctual, thorough, never complains about the grueling night shifts. To the world, Victor is just another retiree trying to make ends meet. But no one suspects that behind those weathered hands lies 35 years of combat surgery experience. Thousands of soldiers owe their lives to skills that now scrub blood from operating room floors. That morning started like any other. Victor clocked in at 4 a.m., changed into his blue janitor's uniform, and began his rounds in the surgical wing. He had just finished mopping the hallway outside the emergency department when he heard the commotion. A training unit had been running morning PT when Private First Class Luke Brennan, 22 years old, collapsed mid-stride. His heart simply stopped. The ambulance rushed him to the ER. Nurses immediately began CPR. The attending physician, Dr. Rebecca Hartley, a talented young doctor fresh from residency, took charge. "Get me the crash cart. Start compressions. Where the hell is Dr. Sinclair?" The on-call surgeon was 15 minutes away, stuck in early morning traffic on Highway 87. 15 minutes that Luke Brennan didn't have. Victor heard everything from the hallway. He stopped mopping. His trained ears caught the rhythm of the chest compressions. Too shallow. The technique was off. He heard the panic in the young doctor's voice, the desperation of someone who knew she was losing a patient. He set down the mop and walked to the doorway. The scene unfolded before him with terrible clarity. Private Brennan on the gurney, his face blue, his chest barely rising. 3 nurses rotating CPR. Dr. Hartley coordinating, but her hands were shaking. She was good, but she was young. She'd never lost a patient this way. Victor took one step into the room. "Get me gloves. Now." Every head turned in complete silence. Dr. Hartley's expression shifted from confusion to anger. "Excuse me, who are you?" Victor locked eyes with her. "Someone who's done this 1,000 times. That compression depth is wrong. You have maybe 2 minutes before brain damage sets in. Get me gloves or get out of my way." The authority in his voice was undeniable. A nurse, working on instinct, handed him a pair of surgical gloves. Victor snapped them on with practiced efficiency, stepped to the gurney, and placed his hands on Luke's chest. The compressions he delivered were textbook perfect. Deep, rhythmic, precisely timed. "Someone bag him properly," Victor commanded, not a request. A respiratory therapist adjusted the ventilation. Victor continued compressions for 30 seconds, then stopped to check the monitor. Flatline. Charging to 200. Clear. He delivered the shock. Nothing. Again. 300. Clear. The second shock jolted Luke's body. Still nothing. Dr. Hartley stood frozen, watching this janitor command her emergency room with the confidence of a seasoned surgeon. Who the hell was this man? Victor didn't wait for permission. "Get me an intracardiac line. We're going direct." Dr. Hartley snapped back to reality. "That's an extremely risky procedure. We should wait for Dr. Sinclair." Victor looked at her, his voice calm but firm. "In 2 minutes, this soldier will have permanent brain damage. In 5, he'll be dead. I'm not waiting." Something in his tone made Dr. Hartley step aside. "Fine. But I'm documenting everything.
Victor turned to the surgical tray, his hands moving with muscle memory built over decades. He located the intracardiac catheter, positioned it carefully, and inserted it directly into Luke's chest cavity. The precision was flawless, no hesitation, no wasted movement. He administered epinephrine directly to the heart. 30 seconds passed, nothing. Victor began compressions again, now combining them with targeted drug delivery. His entire focus narrowed to one goal: restart Luke Brennan's heart. Come on, soldier. You don't get to quit on me. Another shock. The monitor beeped once, then twice, then a steady rhythm. Luke's heart was beating. The emergency room erupted in controlled chaos. Nurses stabilized vitals, respiratory adjusted oxygen levels, and Dr. Hartley checked pupil response. Luke Brennan was alive, his brain function intact. Victor stepped back from the gurney, stripped off the gloves, and turned to leave. Dr. Hartley grabbed his arm. Wait. Who are you? Victor gestured to the name tag on his uniform. Victor Kane, janitorial staff. Her eyes widened. Janitors don't perform intracardiac catheterization. Victor picked up his mop from the hallway. This one does. He returned to cleaning, leaving behind a room full of stunned medical professionals. Within 30 minutes, the story had spread through the entire hospital. The janitor who saved the soldier's life with a procedure most doctors wouldn't attempt. By noon, Colonel Diana Frost, the hospital commander, was standing in the janitorial supply room. Victor was restocking cleaning supplies when she walked in. Mr. Kane, my office. Now. Victor followed her through the hospital corridors. Eyes tracked him everywhere. Whispers followed. The janitor. He saved Brennan. How did he know how to do that? Colonel Frost closed her office door and gestured to a chair. Sit. Victor sat, still wearing his blue uniform. Frost pulled up a file on her computer. I ran your name through the system. Dr. Victor Kane, Lieutenant Colonel, retired. 35 years as an Army combat surgeon. Served in Desert Storm, Somalia, Afghanistan, Iraq. Over 10,000 documented field surgeries, Bronze Star, Purple Heart, and the Legion of Merit. 2 tours as Chief of Trauma Surgery at Walter Reed. She looked up from the screen. And for the past 3 years, you've been mopping my floors. Victor met her gaze calmly. Yes, ma'am. Frost leaned back in her chair. Why the hell are you working as a janitor? Victor took a deep breath, as if deciding how much to reveal. Because I need to eat, ma'am. The answer hung in the air. Frost studied him for a long moment. That's not an answer, doctor. That's an evasion. Victor looked down at his weathered hands. 3 years ago, my wife Eleanor died from pancreatic cancer. The treatments weren't covered by insurance. I sold our house to pay the medical bills. My military pension covers rent and groceries, barely. I applied for surgical positions, consulting roles, teaching jobs. The answer was always the same. Too old. Liability risk. Insurance won't cover it. Frost felt a knot tighten in her chest. So you became a janitor. Victor nodded. It's honest work. I'm close to medicine without the heartbreak of being pushed aside. Frost stood and walked to the window overlooking the hospital grounds. Dr. Kane, what you did today saved the young man's life. That kind of skill doesn't disappear with age. Victor remained silent. Frost turned back to face him. I'm offering you a position. Surgical consultant. You'll work with our trauma team, supervise complex cases, train younger surgeons. $120,000 a year plus full benefits. Victor blinked, stunned. Ma'am, I make $28,000 as a janitor. I know. And it's an insult to what you're capable of. Victor hesitated. Colonel, with all due respect, your hospital staff just watched a janitor perform emergency surgery. They're going to have questions. Concerns. Some will resent me. Frost smiled. Let them. You'll earn their respect the same way you earned mine. By being the best at what you do.
On Monday morning, Victor walked into Fort Bragg Military Hospital, wearing surgical scrubs for the first time in 3 years. His new office was small but functional, located in the surgical wing. The nameplate on the door read, Dr. Victor Kane, Senior Trauma Consultant. He paused before entering, his hand resting on the doorframe. 3 years ago, he thought this part of his life was over. Today, it was beginning again. The resistance started immediately. Dr. Graham Sinclair, Chief of Surgery, 45 years old, Harvard Medical School graduate, was not pleased.
In the morning staff meeting, he made his displeasure known. Colonel Frost has appointed Dr. Kane as our senior trauma consultant. I want to make it clear that all surgical decisions still go through me. Victor sat quietly in the back of the conference room. Sinclair continued, his tone sharp. Dr. Kane, I understand you have field experience, but modern trauma surgery has evolved significantly. We use advanced imaging, robotic assistance, minimally invasive techniques. Things you wouldn't have encountered in a field hospital. Victor looked up calmly. You're absolutely right, Dr. Sinclair. I'm here to learn as much as I'm here to teach. The answer diffused some of the tension, but not all of it. Younger surgeons whispered among themselves. Who does this guy think he is? He's been mopping floors for 3 years, now he's our consultant. The first real test came 2 days later. A helicopter crash during a training exercise left 3 soldiers critically injured. The ER was overwhelmed. Dr. Sinclair assigned Victor to observe, not operate. Dr. Kane, you can watch from the observation deck, take notes. See how we do things now. Victor stood in the observation gallery overlooking operating room 3. Below, Dr. Sinclair worked on Captain Alex Drummond, 34, multiple internal injuries from the crash. The surgery was going well until it wasn't. A sudden rupture in the hepatic artery, blood flooded the surgical field. Sinclair's hands froze for just a second. That second was enough. Victor didn't think. He moved. He scrubbed in, pushed through the OR doors, and was at the table before anyone could stop him. Clamp here. Suction there. Move. His hands took over, guiding Sinclair's team through the crisis. Within 90 seconds, the bleeding was controlled. The surgery stabilized. Sinclair stared at Victor, emotions warring on his face. Pride, anger, relief, resentment. You were supposed to observe. Victor stepped back from the table. I observed you losing a patient. I stopped observing. Sinclair wanted to argue, but he couldn't. Victor had just saved Captain Drummond's life and possibly Sinclair's career. After the surgery, Victor found Sinclair in the surgeon's lounge. Dr. Sinclair, I didn't mean to undermine your authority. Sinclair looked exhausted. You made me look incompetent in front of my entire team. Victor sat down beside him. No. I made sure your patient survived. There's a difference. Sinclair was silent for a moment. That arterial clamp technique you used. I've never seen it done that way. Victor nodded. It's something I learned in Kandahar. We didn't have advanced imaging or robotic arms. We had our hands and our training. Sometimes the old ways work when the new ways fail. Sinclair took a deep breath. I've been chief of surgery here for 8 years. I graduated top of my class. I've published research, and today, a 68-year-old janitor showed me how to save a life. Victor met his eyes. I'm not here to replace you, Dr. Sinclair. I'm here to make sure soldiers like Captain Drummond go home to their families. Something shifted in Sinclair's expression. The resentment began to fade, replaced by reluctant respect. Teach me that clamp technique. Victor smiled. Tomorrow morning. Bring coffee. It's going to be a long lesson. Over the next few weeks, Victor became an integral part of the trauma team. He didn't take over surgeries. He guided, advised, and taught. Young surgeons who initially resented him began seeking his input. Dr. Hartley, who had witnessed his first emergency intervention, became one of his strongest advocates. But not everyone was convinced. Dr. Jennifer Marks, head of the hospital's insurance and risk management, raised concerns. Colonel Frost, Dr. Kane hasn't practiced surgery in 3 years. His certifications are outdated. If something goes wrong, the hospital is liable. Frost listened patiently. Dr. Marks, in the 6 weeks since Dr. Kane joined our staff, our surgical success rate has increased by 12%. Complication rates have dropped. Patient outcomes have improved across the board. Marks persisted. That's anecdotal. What about formal qualifications? Frost handed her a file. Dr. Kane has agreed to complete recertification. He's already passed the written exams. He'll complete his clinical hours within 3 months. Marks had no response.
The real challenge came 8 weeks into Victor's new role. A mass casualty event. A training convoy was ambushed during a live fire exercise. Miscommunication led to friendly fire. 7 soldiers critically wounded. 2 in cardiac arrest, multiple traumatic amputations. The hospital declared a code black. All available surgeons to the ER immediately. Victor arrived to chaos. Gurneys everywhere, blood on the floors, nurses running between patients. Dr. Sinclair grabbed him. Victor, I need you on Trauma Bay 4. Sergeant Wade, double leg amputation, severe hemorrhaging. He's critical. Victor didn't hesitate. He took charge of the bay, directing the team with calm authority. The injuries were catastrophic. Sergeant Nathan Wade, 29 years old, had lost both legs below the knee in the blast. The bleeding was massive. Standard protocols weren't working. Victor made a split-second decision. We're going to use a tourniqueting technique from Vietnam. It's not in the current manual, but it works. The attending nurse hesitated. Dr. Kane, that's not. Victor locked eyes with her. I've done this 40 times. Trust me. He worked with absolute focus, applying pressure points and temporary grafts that bought critical time. Within 12 minutes, Sergeant Wade was stabilized and ready for transfer to the operating room. Victor moved to the next bay without pause. By the end of the night, all 7 soldiers survived. 2 required extensive reconstructive surgery, but they were alive. In the aftermath, Colonel Frost called an emergency meeting with the hospital's senior staff. Tonight, we faced the worst mass casualty event this hospital has seen in 5 years. Every single patient survived. Dr. Sinclair, can you explain why? Sinclair stood. Ma'am, it's because Dr. Kane used field techniques that aren't taught in modern medical schools anymore. Techniques that were developed under fire in places like Vietnam, Iraq, and Afghanistan. He saved lives tonight using methods I didn't even know existed. Dr. Marks, the risk management officer, spoke up. Those techniques aren't FDA approved. They're not in our protocols. Victor, sitting quietly in the back, finally spoke. You're right. They're not FDA approved. They were approved by necessity. By soldiers bleeding out in the field. By situations where you don't have time for committee approval. Frost nodded. Dr. Marks, I appreciate your concern for liability. But tonight, 7 families will get to keep their sons, brothers, and fathers because Dr. Kane was here. That's the only approval I need. The room fell silent. Frost continued. I'm expanding Dr. Kane's role. Effective immediately, he will lead a new initiative, the Combat Medicine Integration Program. He'll train our surgeons in field techniques, document these procedures, and create a formal training curriculum. 2 months later, Victor stood before a classroom of 30 military surgeons from bases across the country. The program had grown beyond Fort Bragg. Now it was a DoD-wide initiative. He clicked to the first slide of his presentation. Gentlemen and ladies, what I'm about to teach you isn't in your textbooks. It's not pretty. It's not elegant. But it works when nothing else does. For the next 6 hours, Victor shared 3 decades of battlefield surgery knowledge. Techniques for controlling hemorrhaging without proper equipment. Emergency amputations under fire. Treating traumatic brain injuries in the field. The surgeons listened with rapt attention. This wasn't theory. This was survival. At the end of the session, a young Army surgeon named Captain Ramirez approached. Dr. Kane, I deployed to Syria last year. We lost a soldier because I couldn't control arterial bleeding fast enough. If I'd known what you taught us today, he might still be alive. Victor placed a hand on his shoulder. Captain, don't carry that weight. You did everything you knew how to do. Now you know more. Use it to save the next one. 6 months into the program, Victor received a letter. It was from Sergeant Wade, the double amputee he'd saved during the mass casualty event. Dr. Kane, I wanted to thank you personally. I'm learning to walk with prosthetics now. The doctors say I'll be able to return to active duty in a limited capacity. My wife tells me I'm lucky to be alive. I know I'm lucky you were there. Sir, I heard you used to be a janitor at the hospital. I don't know how that happened, but I'm grateful you were in the right place at the right time. You gave me my life back. Respectfully, Sergeant Nathan Wade. Victor read the letter 3 times. He kept it in his desk drawer, pulling it out whenever doubt crept in. Because that's what this was all about. Not titles, not prestige, just giving soldiers a chance to go home. 2 years after joining the trauma team, Victor received a call from the Pentagon. The Secretary of Defense wanted to meet with him. Victor flew to Washington, D.C., unsure what to expect. In a conference room overlooking the Potomac River, Secretary of Defense, General Raymond Clark, greeted him. "Dr. Kane, your combat medicine integration program has been implemented at every major military hospital in the United States. Survival rates in trauma cases have improved by 18% across the board." Victor remained humble. "Sir, I'm just sharing what I learned from soldiers much braver than me." Clark smiled. "Don't sell yourself short, Doctor. The Joint Chiefs want to expand your program internationally. NATO partners, allied nations. We want you to lead it." Victor was stunned. "Sir, I'm 70 years old." Clark leaned forward. "And you're the best combat surgeon alive. Age is just a number when you're saving lives." Victor accepted. Over the next 3 years, he traveled to 17 countries, training military surgeons in combat medicine. He taught in Germany, South Korea, Poland, Australia, and Japan. Everywhere he went, the story was the same. Older surgeons with field experience were being pushed aside for younger doctors with advanced degrees but no battlefield knowledge. Victor changed that. By age 73, Victor had trained over 5,000 military surgeons worldwide. His techniques were now standard protocol in NATO combat hospitals. Survival rates in battlefield trauma care had reached historic highs. But Victor measured success differently. He measured it in letters from soldiers who survived because someone knew what to do in those critical seconds. One letter stayed with him. "Dr. Kane, I'm Lieutenant Emily Preston. I deployed to Afghanistan 3 months ago. Last week, our convoy was hit by an IED. One of my soldiers had a femoral artery rupture. I used the compression technique you taught me. He survived the helicopter ride to base. He's going to make it. Sir, before your training, I wouldn't have known what to do. You saved his life through me. Thank you." A grateful combat medic, Lieutenant Emily Preston. At 75, Victor decided to retire for real this time. Not because he couldn't continue, but because he'd built something that would outlast him. The retirement ceremony took place at Fort Bragg, where it had all started. In attendance were hundreds of surgeons he'd trained, soldiers whose lives he'd saved, and hospital staff who'd watched him transform from janitor to legend. Colonel Frost, now a general, gave the speech. 5 years ago, Victor Kane was mopping these floors. Today, he's changed the way military medicine is practiced worldwide. Over 10,000 soldiers owe their lives to his techniques. But Victor would never say that. He'd say he just did his job. Victor stepped to the podium for his final speech. "When I started cleaning these hallways, I thought my career was over. I thought I had nothing left to offer." He looked at the faces in the crowd. Surgeons, soldiers, nurses, janitors. "I learned that true skill doesn't expire. It just waits for the right moment to be recognized. And I learned that dignity doesn't come from your job title. It comes from doing your work with honor, whether you're holding a scalpel or a mop." After the ceremony, Victor returned to the janitorial supply room one last time. His old supervisor, Rosa, was there. "Dr. Kane, we're so proud of you." Victor smiled. "Rosa, can I ask you something?" "Of course. Can I leave my old uniform here? As a reminder." Rosa's eyes filled with tears. "It would be an honor." Victor hung the blue janitor's uniform in the closet, next to the mops and cleaning supplies. Then he walked to his car for the last time as an employee of Fort Bragg. Driving home, he reflected on the journey. From surgeon to janitor to surgeon again. From invisible to indispensable. The road had been long, painful, humbling. But it led him exactly where he needed to be. True expertise never expires. It simply waits for the moment when it's needed most. And sometimes, the greatest heroes are the ones we walk past every day without noticing, until the moment they step forward and remind us what real skill looks like. If this story moved you, share it with someone who needs to remember that experience and wisdom are never wasted. Subscribe to witness more stories of quiet heroes who prove that dignity and competence transcend age, title, and circumstance.